Sam here for Anytime Fitness, personal trainer. Today I'm going to talk about low back pain and just my couple recommendations and kind of my crack at it to kind of relieve some back pain. Back pain is very a multifactorial kind of issue. That a lot of stuff can go on, but this is just a couple things. Might come back to this in another series, but this is just a few mobilizations and things that I think that will help relieve a lot of people. But like I said, it's a whole system thing. It's not just your low back that could be compensating for the issue. A lot of things that I see with people who do a lot of sitting all the time, front of the hips get very tight on people. So they'll think they're in a good position by keeping their chest up, but as you can see, as soon as I start going like this, you become overextended, and because the front of the hips are tight from sitting all day on a computer, upper back is hunched. So there's a lot of factors that go in. Also, like tight ankles, could have things going on with your hips. There's a lot of things to talk about. So I'll do a few mobilizations on things that take, like I said, a crack at your low back pain today to try to help you out. So most of these things, some of the soft tissue, some of like the releasing kind of stuff, I would say for after a workout or before you go to bed is great. But some of the banded stuff that I'm going to show you, you can do it right before you go to train or really any time of the day. So the first thing I like to do for people is just a ball. You can also use like a ball like this, any little kid ball. This is just a Supernova from MobilityWOD.com. There's a muscle in here called the psoas, which what it does, it flexes. So anytime you're overextending like this, it's pulling. It attaches to your spine and attaches into your groin, so it's pulling you forward, which could be causing a lot of your low back pain. So one way to release that or try to just calm that down a little bit is taking a ball, do some gut smashing. I know it sounds worse than it really is, but you take your time with these. Everything I'm going to show you also today take about 2 minutes, even more up to 5 minutes per side, per mobilization for it to release, so you have some relief. So you don't just go with this for 5 seconds and then that's it. It takes time for this stuff to happen. You know, it's years and years you've built on this over the years of bad posture, bad sitting patterns, everything. So take your time with this stuff. So the first thing I'm going to show you is you can take this ball, you put it anywhere from top of your pelvis all the way up to underneath your rib cage, anywhere on the side. One thing, if you do this, you shouldn't feel any pulsing. If you do, probably on an artery, so get off it. But anything else, if it feels kind of gritty in here, it's going to be very tight for people. Take your time, and breathing is another big thing. So you have to make sure you're breathing. So what you do is you just put this ball on your stomach. You can start up here on your elbows. And as you can see, it's just on the right side, kind of where my belly button is, down to where your pelvis starts, anywhere in that area to start. You just relax. You can come here. You need to breathe, guys. So don't sit here all tensed up. You know, this is the time to relax. So you breathe. You then, once become that, if you feel anything release, you can come all the way down like this. Kind of move around a little bit. Another one that I like to do is bring your leg up like this. You can kind of rotate. If it's kind of tight there, take some big breaths. Like I said, guys, I'm kind of doing this a little bit faster just for the sake of the video. But on these, each side, take 4 or 5 minutes per side. So you sit here and sink into the ball, breathe into the ball. And then you do the same thing on the left side. So that's a big issue. So the psoas is something I'll go after. So the next one I'll show you is the muscles in the back, your lower back here. Quadratus lumborum is a muscle that connects from your lower ribs down here and connects to like the top of your pelvis, which could also be tight pulling. So another one, you take a lacrosse ball, okay? What you do is you can either put your feet up on something like this. You're kind of going the opposite side like we just did, but instead of being in the front, you're in the back. So you put it anywhere from the top of your pelvis to the bottom of your ribs, on the side of your spine, don't go on your spine. You can sit here. What I like to do then is kind of go over to the side like that and breathe. You have to breathe, guys. You can't sit here all tense, like I said, at any of these because you won't get a release. You need to relax. You're trying to get into your parasympathetic nervous system, so you need to relax. You can sit there on that side, kind of go up and down, find where you're tight, and then you would do the same thing. Put the ball on the other side. Kind of tip over like this to get some pressure on it. And breathe. So that ball can go anywhere from the top of my pelvis, anywhere up to the bottom of the ribs here. Same thing on the other side. So those are 2 soft tissues that I like to start on, okay, with people. And then the next one, like I said, front of the hips get very tight. Hip flexors, TFL, a lot of stuff in here gets very tight from overextending, from sitting all the time. So one thing I like to do is to get after extension of the leg, trying to get your leg behind you. Because if you can't do that motion, you're going to extend at the lower back. So one that I like to do, you set up a band, lower on a pole or something like that. You put it all the way up in your groin. You come back, try to get this knee as far back as possible. You let that hip, you don't extend here like this. Okay, you need to squeeze the butt, stay tight here. You do a lot of things in this position, okay? This is pulling the hip socket forward. You can kind of rock back and forth. You can even come down like this. Make sure your butt is always on. Do not overextend at the lower back because it could just cause more low back pain. So you need to stay tight here. You can come all the way up like this. Mess around also with your foot position. You have your foot out, foot in. Any of these motions, take your time and breathe. Okay? Like I said, I really like this one. And also you can play with the front foot position, bring that over a little bit. There's no right or wrong. Wherever you're tight, spend time there. So you sit here, you kind of rock back and forth. So you do the same thing on the other side. The other one I'll show you is to go after flexion of the hip, okay? To drive the hip socket backwards a little bit. So I like this one. You do the same thing like we just did, but now the band is on the front leg, okay? So you're here like this, have it on your groin again, take a few steps forward, you come here, you sit in this position, okay? You might need to be up on your hands at first, okay? And always make sure when you look at your foot, guys, don't let your foot be collapsed in, okay? Have big toe, little toe, heel on the ground, and you're here. You're always breathing, okay? You can mess around with your knee position, in and out, even rotate like this. Rotate like that, mess around, bring the back leg up like that, and just kind of breathe and try to sink down into that, okay? So those, and do the same thing on the other side. So those are just a few, I haven't talked about calves, I talked a little bit about ankles before, but like I said, it's multifactorial. So as you can see, when you do this stuff, especially the band stuff, you see I'm kind of breathing a little bit. You can do it before a workout. Okay, so now you're not relaxing on the ground. That's why usually the soft tissue stuff I do for after workout. But stuff with the bands gets your joints moving a little bit, get in a better position for the workout. So those are a few things that I like to take a crack at with people with low back pain. But that's pretty much it for today. I might have part 2, part 3 if you guys like this kind of stuff. So that's it for today, guys. And I'll see you next time. This is Sam. Peace out.
Thanks.